Hello, everyone, and welcome to today's session. My name is Crystal Fullerton, and I am with the Farm Safety Coordinator of the PEI Federation of Agriculture. Today, with a grant from the PEI Workers' Compensation Board, we're proud to present our Building a Sustainable Farmer webinar series. I'd like to introduce today's presenter, Maureen MacPhee from the Snore Shop. Maureen is a registered respiratory therapist and will be discussing with us the importance of getting a quality sleep, what factors prevent us from getting a full night's rest, and the options available to you if you are looking for help. A few housekeeping issues to begin with. Our speaker has asked that you wait until the end of the presentation to ask questions to help minimize some of the distraction. She will answer them all, but at the end of the presentation. We do have a chat and a Q&A section, so please look out for this option. There is a section there where you can click off the button to become anonymous in case you're feeling self-conscious about asking certain questions. We encourage all dialogue because we want you to get as much as possible out of these webinars. Sometimes being anonymous will help questions pop up that others are too shy to ask. So please ask away, as this session is learning about the importance of sleep fatigue on the farm. Also, there will be a poll during this webinar. We will wait until the presentation is complete and before we start asking questions to open up the poll. And we really do ask that you participate in this. It only takes a minute. It's a very simple yes or no multiple choice, and it helps us and our funders to determine if we're moving in the correct direction with our webinars. If you have any additional questions after the event or suggestions for other speakers, you can contact us at farmsafety@peifa.ca. That's farmsafety@peifa.ca. We will also be providing a recorded version of this webinar at a later date, so please check our website and YouTube channels, and we would love for you to share this information. For those of you who are just joining us, welcome. Now I'm going to pass over this webinar to Maureen, and please enjoy.
Hi guys, so thank you very much for introducing me, Crystal. A little background on what I do. Sorry, didn't mean to adjust that, but I am an RT, a registered respiratory therapist, and I actually do the clinical education sessions in Atlantic Canada for physicians and community events and workplace events. So I talk about sleep and we talk about how we can improve, how to diagnose sleep disorders and sleep disorder breathing so that we can achieve a better quality of sleep. So that's what we're going to review today. So if anybody does have any questions, I will definitely welcome all your questions at the end, because that will definitely help guide what information that you guys are looking for also. So let's get started. Okay. So if you can relate to this picture, I'm sure there's a lot of you who have poor sleep schedules due to your work environment, working very, very early in the morning and staying up very late to get your work done. I'm sure this picture might ring a bell. So we know that sleep is a necessary human function, right? We know that sleep is something that we cannot go without. So when we don't sleep soundly or deep, our brains cannot regenerate. So this can affect our moods, our memory, our judgment, and the poor restorative sleep can lead to a lot of illnesses. There's more and more research showing how it's linking to depression and anxiety, obesity, high blood pressure, and so on. A lot of illnesses can be influenced by lack of sleep, also like pain management and pain syndromes. So if there's one person that doesn't have these stickies, I would wonder, how do you get through your life? Because I would like to know. So yeah, so our busy lifestyles are really cutting into our sleep, and we're working more, we're doing more with our children in sports and activities, extracurricular. And, you know, sleep is kind of our last thing that we think about as the most important thing to nurture our bodies. So why do we need to worry about getting quality and quantity of sleep for our work environment, for a healthy work environment? The lack of restorative sleep really does affect our decision making. So, you know, you're working with heavy equipment and trying to be safe in the work environment, but also if you have to work with others, this can impact your decision making, your judgment, and your leadership roles. So your interpersonal relationships are with your coworkers. You know, if you're not getting your good quality of restorative sleep, and then you're getting less sleep, and we'll talk about quantifying what quality and quantity is a little later, because they are two sections that need to be put together. So if you're not getting those, your relationships at home, but you know, we're talking about in the work environment, will be affected in how you relate with others and how you get, you know, your projects done together and how you can get along with each other and work together very well. So it also affects being present, being on the ball, being ready to go, thinking clear, okay, in the environment of you're working, especially if you're working with large equipment. And then being at work, of course, missing a lot of time. So we definitely see when patients get their restorative sleep in the clinic, they're having less sick days, they're having to take off less days for stress and coping, and they're off, they're not going off on sick leave as much. So that definitely affects their days of sick days, okay? Also, we talked about the safety part of it, right? Because we know that there's so much research out there that is showing when you are sleep deprived, your accident rate is up, okay? You know, insurances are actually checking now on sleep apnea as one of the questionnaires when you apply, because they want to know that you're being treated. They want to know that you're getting your restorative sleep, because accidents on heavy equipment, accidents if you're a truck driver, accidents, taxi drivers, but also just your insurance, private insurance. Productivity, well, we know when we're tired, we don't get things done. It's not rocket science. So you're definitely at a better rate of being productive if your focus and your clarity is there. Okay, so when you're getting sleep, you're definitely more productive. And then we talked about health and stress. You can't deal with health issues, you can't deal with your stress levels if you're not getting restorative sleep. Okay. So these are the hours that is required by age. Some people are shocked to see this, especially those of you that have teenagers. I'm sure they don't sleep 9.5 hours. So I talk to my kids all the time, and they're like wanting to stay up later and later and later, and then they wonder why they can't concentrate in school or they're moody. So we have to go back to the basics, and it really does make sense that if we go back to what is, you know, just like you're supposed to drink your water, you need your quantity of sleep. So this is talking about your quantity for adults, 7 to 9 hours. Now, if you were in person with me, I would make you raise your hand and tell me who sleeps 7 to 9 hours. And I bet you less than half of the people would raise their hand. So if we go back to these basics, that's going to help with the quantity of sleep, okay? So how many people are doing this? Drinking coffee, can't concentrate on their laptop. So if you're feeling like this, then you might be ready to take control of your sleep and choose to do something about it. So I don't know if you guys actually know that our sleep has 5 stages. So there is a non-REM stage, and then there is REM. So most of us know what REM is now just because of Fitbits, and it tells you your REM sleep, and everybody's into this. Oh, I'm getting enough REM. So that's not a diagnostic criteria. It's a guide, and they're very helpful. And my patients actually use them a lot once they're treated with their sleep apnea, but we'll talk about that after. So the non-REM is our first 4 stages. So a lot of our night is actually spent here, okay? So if we only have 60% of our night here and 40% of our night in REM sleep, we really do have to get enough sleep to accomplish your stages of your 20 to 25% of your night in REM. And that'll be explained in the next slide. So stage 1, that's when you're just drifting off into a very light stage. That's when you kind of feel that like falling sensation, you know, or you're very easily alerted if you hear a noise, okay? It's almost like you feel like you're not in sleep. Stage 2, 50% of our night is spent here. So that's like your light, you're getting to some deeper, okay? And we go through these stages all night. So you go from light, deep, okay? So we usually have about 3 or 4 cycles of those. Stage 3 and 4 is your deep sleep prior to your REM. So that's the restorative sleep, the portion of the sleep where the body repairs and restores. So this sleep is very important before your REM. REM sleep, so that's your dreaming sleep, okay? This is where the brain restores. So this is where it is vitally important to get enough of this to be able to work in a safe work environment, right? Because we actually need our brains to be on the ball when we're on those heavy equipment, when we're on the road, when we're dealing with time constraints, when we're dealing with interpersonal skills. Like this is the part of sleep that is so vitally important to be an efficient worker, okay? So REM sleep, the dreaming sleep, it's where our brain actually takes everything we learned and sorts it away, okay? So can you imagine if you went into your office and say everybody kept throwing files at you? That happens to me all the time. Throw files, okay? And then you say to yourself, okay, now I have to go through all this and I have to sort out this task and this task and this task. If people keep throwing files at you, you're never going to get that done. So you're literally rolling on this hamster wheel constantly and not getting anything sorted, right? So that's what happens when we don't have enough REM sleep. You can't focus, you can't get those cognitive skills sharp. So you can't get your words out. You have a hard time sorting through things and getting your task done, okay? So we require, like I said, 20 to 25% of our night in REM. And like I said, if you don't get enough hours of sleep, then you're not going to get 20 to 25% of your night in REM that allows you to feel restored, okay? So this broken sleep affects a person's, like we said, memory, cognitive abilities, so your focus and your ability to cope. And that coping really comes into play with stress management. And we know all of us have very stressful positions, especially right now with COVID. It's so changed. So getting your restorative sleep is vitally important. So we talked about the quantity. We know we need 7 to 9 hours, and we know we need uninterrupted sleep. But are you getting the quality of sleep? So average sleep quality was actually better related to a sleepiness than sleep quantity, because in our brains, we think, oh, well, I'm getting my 8 hours. I should be fine. The results indicate that the healthcare professionals should focus on sleep quality, in addition to the sleep quantity, of course. But the sleep quantity to us should be not rocket science, right? If you go to bed at 10, get up at 6, you're good, right? Or shift it. So in the efforts to understand the role of sleep in daily life, the quality of sleep is even more important. These are body's functions, just so you understand how sleep deprivation can affect us, okay? So impaired cognition, we talked about that. So your memory, your processing, okay? You know, if you're tired, it's really hard to focus at work. Increased symptoms of depression. I would say at least 90% of my patients are on an antidepressant or anti-anxiety medication because you can't cope with life, okay? It's hard to get things going when you're sleep deprived. It's hard to deal with a lot of, you know, home issues, work issues, stresses. But it also disrupts the neurotransmitters, which regulate your mood when you have sleep deprivation. So higher levels of anxiety, I'm kind of skipping through there. I don't know if you can see on the screen. I kind of went to the left to the right. I'm just going to stick on the left first. So higher levels of anxiety. The lack of sleep raises your brain anticipatory reaction. So it's that fight or flight, okay? So you know when you go into the office, at the doctor's office, and your blood pressure's up, that's that fight or flight mode. So doctors know to compensate for that, right? When you're more anxious, you go into that stressed response and your cortisol levels go up, okay? Well, that heightens if you're sleep deprived. So you're always going to feel a little bit more overwhelmed and on edge and anxious, okay? Stroke risk. So there's studies that show when you sleep 6 hours or less a night, your chances of stroke increases by 4 times as much, okay? And we'll talk a little bit more about stroke and cardiac conditions later. Increased risk for diabetes. I think everybody would know now that when you're sleep deprived, you actually do have an increase in your, like I said, the cortisol, but obesity rate goes up when you're sleep deprived. Okay. And that cortisol release when you're sleep deprived, and those are the natural hormones that will go up when someone is sleep deprived, increases your glucose, so your sugar levels in your body, okay, which then stores fat. So then you're at a higher risk for diabetes because your insulin has to try to take over. So your pancreas tries to control that insulin. So over time, you can go into a metabolic syndrome where diabetes, type 2 diabetes can occur. Increased risk of depression. We talked about that on the right-hand side. Increased risk of cancer. More and more studies are showing with less than the 7 to 9 hours required sleep can increase your risk of inflammatory in the body, which then changes cells. So there's lots of research going into that. This one says breast cancer, because it affects your hormones. I don't know the exact pathway, but it does change your estrogen levels. So in women, it can, I'm not sure in men, I'll have to look that up. Increased risk for heart disease, we know because the cortisol levels up causes your blood pressure to increase, okay? And blood pressure is supposed to decrease when you are actually asleep. So I'm just gonna add that. Okay. And then weight gain, we already talked about that. So your satiety center is not satisfied when you're sleep deprived. So your hormones will make you feel hungry. So that's why we're always looking for that quick carb when you're tired. These next 5 domains, areas need to be achieved to get quality of sleep, okay, which is your restorative. So we talked about the quantity. This is the quality. So the restorative sleep. All right, so circadian misalignment, I'm going to go and explain what that is. So there's 5 things: the circadian misalignment, so that, pharmacological factors, medical factors, psychosocial factors, and primary sleep diagnosis. All these can affect your quality of sleep, okay, and your quantity, really. Circadian misalignment. So these mean irregular sleep and wake times, okay? So people that work shift work are really long days. When you're a farmer, I know you guys work really long days. Correct me if I'm wrong if you were here in person, but you're up very early typically. So increased likelihood of a workplace accident. We talked about how basically that can occur if you don't get restorative sleep. Then if you work a weekday, a weeknight, variations like a shift worker, that can also cause severe accidents because you don't have a set sleep cycle. Okay, so your body doesn't know when to get into those normal sleep cycles of 1, 2, 3, 4 stages, and then your REM sleep, and then backwards. Okay, so your body is shifting its sleep cycle all the time. So that figure, the 4 times more likely to have severe accidents, is the Academy of Sleep Medicine. Jet lag, we know if we're traveling a lot right now, we're not, of course, but if you are one of those people that have to travel a lot for work, it takes a good week to get your clock readjusted after your time change of what you did. So it takes a good week, and that, you know, most people that travel a lot know that, but just so you do know, it doesn't just happen in a night or two. It does take a really good week of consistent, normal sleep time, wake time. Partial sleep deprivation. So if you have under the required 7 to 9 hours, you have a 30% higher death rate, which is very high. So, you know, if you can get 7 to 9 hours, that, you know, it's only an extra hour. It's really important to achieve that required amount by the Academy of Sleep Medicine. Okay, so pharmacological factors. These are, you know, you might not know exactly what these are, but we'll touch base on this. So some cholesterol medications, a lot of people are on cholesterol medications. They can cause some pain syndromes. So if you are on them and you are waking up with leg pains or your legs are restless, that's something you might want to address with your doctor if you're waking up. These 2 next ones, they're for heart failure and blood pressure. Sometimes they can cause some coughing at night, but there's a lot of other things that can cause coughing also, like uncontrolled asthma, but those are under medical condition factors we'll talk about. Antidepressants, anti-anxieties, and antihistamines. So Benadryl can produce restless leg syndrome. So some people take Benadryl to sleep. You're better off talking to your family doctor about an actual sleep aid, because Benadryl can produce a restless legs, and that can wake you up. Elavil, Prozac, and Lexapro, these are antidepressants. Elavil and Prozac are used a lot that I see in clinic, but they also can make your legs restless, and it's not always a true restless leg syndrome. Increased sleep onset latency or increased number of awakenings and arousals that lead to an overall decrease in the quality of sleep. So Paxil and Prozac increases sleep onset. So what sleep onset is how long it takes to get into your first stages. So I see Paxil all the time and Prozac, excuse me. So if I saw a patient in clinic and they were saying to me, there's no way, I lay there for hours on end. If this is, you know, you might want to address that with your family doctor also, but obviously don't go to your family doctor if all these apply, but well, you know, these are things just to be aware of. And Flomax, so prostate for men, if they're on Flomax, they can have less REM cycles, and so less than the 20 to 25, and they might actually feel tired too. The medical factors, this is another domain that can affect your sleep quality. So reflux, so uncontrolled reflux, fibromyalgia, pain syndrome, rhinitis, so allergies, okay? And I just want to add there too, asthma. A lot of patients that I'm seeing are asthmatic, and it's affecting their sleep quality because they're not controlled. Okay, so if you have symptoms of your asthma in the daytime or your COPD, make sure you get those looked after, because that's very important to get a good quality of sleep. It's actually how they assess a lot of medical conditions like depression, anxiety, your asthma in control. Are you coughing at night? Are you having a hard time falling asleep for your depression? Okay. Impact perceived quality of wakefulness. So this is what you perceive as you're actually getting deep sleep and you're not always awake. So this is what the patient perceives. So stress is one. So basically we did say stress and anxiety. So patients who have that higher level of cortisol in their body, they have a really hard time getting to sleep, and staying asleep. Okay, and we'll talk about how to help that. Chronic pain, lots of back patients, I bet you, in your work environment that have poor, spines, that have disc degeneration, what have you, that definitely can affect their perceived deep sleep and affect their deep sleep, of course. And they usually report fatigue more often because of the pain taking from their feeling of restored sleep. So cardiopulmonary disease, we talked about that. So patients that have really bad or poor managed asthma or COPD will generally feel fatigued also. Number 4 is psychiatric conditions and psychosocial factors. So affecting their sleep, like PTSD definitely affects people's quality of sleep. They often have a lot of nightmares and hard to get settled to sleep and relaxed. Depression, it is quantified how poor or managed your depression is by your sleep quality. So doctors will ask you, are you sleeping well, right? ADD, so that attention deficit disorder, they have a harder time relaxing and getting into that sleep onset. Bipolar and anxiety, the same type of things, okay? Social and behavioral patterns of sleep. So noisy partners. So, sorry about that. Noisy partners will affect your sleep quality. And it's not rocket science. If someone is actually snoring, or they're up and they're doing things and they're not going to bed at the same time, that's gonna break your sleep up. Okay. Working long hours, restricting sleep time. Well, we talked about that. So if you're not getting your 7 to 9 hours, that is going to affect your sleep quality also, right? Number 5, sleep disorders, my forte. So some of these have to be, well, most of them, except for the sleep disorder breathing, have to be actually diagnosed in a sleep lab. We currently have a sleep lab in St. John, New Brunswick, that I think a lot of my PEI doctors that I deal with refer to there. And then in Nova Scotia, there's one at the Abbey Lane QE2 here. And those are for patients that are first screened for sleep disorder breathing, because that's the exclusion criteria. And then if there's still issues, then we get your doctor to refer you to the sleep disorders clinic at the sleep lab. So restless leg syndrome, periodic limb movement. Sometimes doctors will treat restless leg syndrome. Narcolepsy has to be diagnosed at the sleep lab. REM behavior disorder, somnambulism, circadian rhythm disorders, and true insomnia. We can talk a little bit about that, all diagnosed at the sleep lab, okay? So the problem with the sleep lab is, and why we don't utilize the sleep lab as much, is because it takes up to 2 years to get in through MSI. So if the doctors will exclude sleep disorder breathing because it is such a high rate of why patients have sleep issues, then we treat that primary disorder. And then if there's any leftover sleep issue during our treatment process, then you'll get referred on to a sleep lab, and it's a lot quicker because the triage is a lot quicker. Okay, so sleep disorder breathing, sleep apnea, one of the leading causes of poor sleep, okay? So this is most people right now with COVID. We're just gonna touch on stress and sleep just for a minute, and then we'll go back into the sleep disorder breathing, but we're all stressed, and and we have to go back to our basics. Like I said, eat healthy, get your water, and get your quality of sleep. So it really, stress affects sleep, and sleep affects your stress levels. So it just goes interchangeable, right? One of the largest causes of the short-term sleep difficulties and poor sleep, which leads to stress. So common stresses. So if we can treat some stress-related issues, we can then get better quality of sleep. So if we address it, common stresses related to pressures are your schooling. Maybe some of you guys are doing schooling on the side, marital issues. I mean, that definitely affects people's sleep if you're up all night worrying. Illness is a huge contributor to how well you're sleeping and how well you're dealing with stress. And financial stresses, right? Financial stresses, I'm sure for a lot of you right now, if you're working outside, maybe not so much, but if you're working indoors, maybe some of you lost your jobs, or you're off working part-time or at home. Financial stress is one of the main stresses in life, let alone contributor to the quality of sleep, dealing with stress. So they often disappear, these stresses, once the issue improves, which is a good thing. But how do we do that? And then what is the stress actually doing to us, our bodies? So when you feel stressed and overwhelmed, your heart rate increases and your muscles tense up and your body starts to produce adrenaline. So the normal response of that fight or flight, okay? This causes then the body, we talked about this, to release sugar into your body, into your blood, along with the stress hormone cortisol, okay? So the cortisol level also is associated with memory issues and weight gain, which is why you're at a higher level for diabetes when you feel a stress all the time with the cortisol up, but then your sleep deprivation. And you get sicker. Your immune system's actually lessened with less sleep and then higher stress, right? So stress affects your sleep. Why? Because the body's stress response causes you to have a heightened awareness. We just talked about that, and how it's more difficult to fall asleep, right? It's more difficult to stay asleep. And your hormones, under normal circumstances, peak late in the afternoon and early evening, which makes it even harder. Okay, so when you're at that heightened stage in the afternoon, you're getting done your day and you're, oh my God, that was such a busy day and I'm tired, and now I have to go run the kids, and now I have to go walk the dog, and I have to get supper, and I got to clean, the kitchen and what have you. So your levels of hormone, stress hormone is up. So then you're going to tell yourself, hey, now you have to close your eyes and fall asleep. So how do we suppress those hormones and get them down, those stress hormones, right? So higher than normal stress throughout the day increases these hormones, making a good night's sleep very difficult to achieve. So if this is you at the end of the day, this is what you have to do. So you can maintain a constant sleep and wake time, okay? We need to be able to get 7 to 9 hours of regular time. Go to bed around the same time, within a half an hour, you're pushing it at an hour, and get up the same time. So restrict naps to 30 minutes if you have to have a nap. So you people that are working at home and you're exhausted, hopefully I'll be able to help you a little bit more. But try not to nap, because that really affects your sleep onset and when you're going to fall asleep. Okay. Exercise regularly. So even if you can get a little bit of fresh air and walk, or do some, you know, kind of activity at your home if you're working from home, or, you know, get your buddy that you're bubbling with, or your neighbor, and go for your walk, it's going to help you get a better sleep at nighttime. Spend more time outside. That's what I said. Overall light exposure actually will help with your sleep. Okay, so we need that light, and then we need the darkness at night, because that actually suppresses our or increases the melatonin in our body. So the light suppresses it, and then at nighttime, the melatonin actually allows us to fall into sleep. So that's our normal hormone. Eat a light snack. So don't eat too much before you go to bed. That actually can cause like nightmares, parasomnias, and then reflux. So there's different things that, you know, eating too late. And when we're busy, we eat late and we eat fast, right? Avoid caffeine. That's a no-brainer. Tobacco. There's a lot of patients that will say they have to have a cigarette to relax. Tobacco is a stimulant. And alcohol. So, you know, that glass of wine at night might be nice, but if you're having sleep troubles, it helps you relax, and it's a sedation kind of mechanism, but it can cause you to have broken sleep, okay? Especially if you're having more than one glass. No electronics. Well, try to tell your kids this, and then try to do it yourself. So anybody that goes on Facebook, Instagram, YouTube, the news, put that blue, check your blue light, right? So you want to make sure that you're not getting that stimulation before an hour before bed. Keep your bedroom cool. That's important. And quiet and dark. Okay. We don't want any of those stimulants in our bedroom. This is just saying, basically, if you're treating your sleep apnea, which we'll get into, that there's a decline in absenteeism. So if we treat sleep apnea and sleep disordered breathing, we have less sick time, okay? And you're more productive. So this article is just saying, this research was saying that there's 17% increase in productivity once sleep apnea is actually treated. And this is what sleep apnea looks like, okay? So if we see that red pathway, that is where a patient in sleep apnea closes off, okay? Some people say to me, well, is something wrong with my lungs? And I said, no, it's something wrong with your, anywhere from your vocal cords up to your nose, there can be obstructive pathways, okay? So the prevalence of sleep disorder, this is where I treat patients, okay? So our clinics actually treat sleep apnea and sleep disorder breathing to help you achieve a better quality of sleep. So you're not obstructing in your sleep and causing you to have broken sleep, okay? So it's very high prevalence. 1 in 3 people have sleep disorder breathing. 9% of women and 25% of men in that middle age category, okay? So between the ages of 30 to 60 years. And 75% of severe sleep apnea patients are not diagnosed. So that is really scary. There's a lot of patients not being screened. So I'm going to help you to find out if you do need to be screened for sleep apnea or sleep disorder breathing, which is a snoring type of breathing that affects your quality of sleep. So do you snore or do you feel tired? If you snore and you experience daytime tiredness, you should discuss this with your doctor. Snoring is a sign of obstructive sleep apnea, which is a condition where you stop breathing repeatedly during sleep. It can cause disrupted sleep, which in turn affects your ability to cope with stress. And obstructive sleep apnea is associated with multiple health concerns, including heart disease, diabetes, anxiety, and depression. So these are the risk factors why you can develop sleep apnea, okay? So it doesn't come out of nowhere. You probably had a milder form if you get diagnosed and it has caught up with you where now you're not feeling as rested. So a patient who has a BMI of greater than 30, you'd have to calculate your BMI. You can type it in, or maybe you know it. It's based on your height and weight. You're at an increased risk when you have a BMI greater than 30. If you're male gender, there is and the reason is because there's a protection mechanism with estrogen in women, but once you get into menopause, you actually have lower estrogen, and then you have more collapsibility of your air passage. So because men don't have that, they're at a more risk. A family history of obstructive sleep apnea puts you at risk. The reason being is because genetics of your anatomy, okay? So if you have hypertension, it doesn't mean that you have sleep apnea, but generally there is a link to apnea patients developing hypertension over time. So these are the things that doctors are looking for in patients when they're screening. And then a man who has a thick neck of 17 inches or greater, because that can impact the air passage, and women that have a 16-inch neck or greater, okay? Women typically don't know their size, but you can take a measuring tape and do it. Excessive alcohol or sedative use, that relaxes your muscles in your airway more, so that can put you at a higher risk for obstructing. Upper airway or facial abnormalities, so patients that have deviated septums that can cause sleep disorder breathing, like snoring, enlarged polyps, small jaw, recessed jaws, the patients that don't have chins, that had like jaw issues, they had to have braces, that can make their air passage more narrow. Smoking causes inflammatory response, so it can inflame the airway and make it more narrow, okay? So an air passage like this, and then you put smoking, which inflames the tissues, makes it more narrow. So basically anything that makes your air passage more narrow can put you at a higher risk. And then there's endocrine and metabolic disorders that can cause them. So signs and symptoms. Normally, if I was in person, I would pass out a sheet or ask if anybody has, 3 of these signs and symptoms, raise their hand, and everybody raises their hand. Not all brain fog is related to sleep apnea, but it's definitely a huge sign or symptom in women. Okay, brain fog is probably one of the leading symptoms that patients go to their doctors for, women. Snoring, we often hear partners complain of the snoring, not typically the patient. Choking and gasping, after people are diagnosed, they actually do say to me, I I went away without my CPAP machine, and my goodness, I woke up gasping. So they had that perceived notion of what was happening, but they now are alert to that. Frequent bathroom visits. So even urologists are screening now, because if a patient is going to the washroom often at night, but not in the day, they do exclusion diagnosis of sleep apnea to rule it out. Dry sore throats when awake. Well, when you have sleep apnea, they're always breathing through their mouth, because your body says, hey, you need to breathe your mouth. We need to increase your oxygenation. You know, you're not breathing, you're obstructing. And then you get dry sore throat. Clenching and grinding. So your body's response to keep that airway open. In some patients, they'll clench and grind, and they get really sore temporomandibular joint, and it's called disorder when the dentist diagnoses it. Excessive daytime sleepiness is the key, but not everybody knows how sleepy they are, and that's even more dangerous because that's how accidents happen, okay? But sometimes it's a partner that says, look, you can't even sit down without falling asleep and watch the news, and they don't often even know they're doing it. Morning headaches. So when your oxygen levels go down because your air passage is closing, that can cause your oxygen to go down and less blood flow to the brain, and you get that heavy, foggy head in the morning. Excessive sweating with sleep. A lot of people get scared because that's one of the symptoms or signs of cancer, along with diabetes, a lot of other medical conditions. But if you're waking up a lot and you're sweating, and it's not, your bed is wet, but you're hot, you're waking up hot, and you're not going through menopause, it's hard to tell, but that can be a sign also because your cortisol's up, right? So if you're in that fight or flight, you're warmer, you have increased cortisol, your blood pressure's up. Weight gain, we already talked about that. We already talked about depression and irritability because of the sleep deprivation. Memory and concentration is impaired because you're not getting your quality of sleep or your quantity, right? So if any of you can relate to the above signs and you want to know if you are getting your restorative sleep, there is a take-home device that looks like this picture, and it's very easy, simple. I mean, you have it there. I'll show it at the end when you have a question part. I have one here. I could put it on and show you. It is a free sleep study, so your doctor doesn't have to refer you. There's going to be a link to book your sleep study online at all the clinics. And basically, you just put in your name, you pick your time you want to pick it up, and you take it home for free, and then your doctor gets the results when you drop it off the next day within the week. Usually takes about a week right now. And then your doctor will actually fax back a prescription if you need to be treated for sleep apnea, or will want to assess you and have you come in to discuss it. But we have a very good relationship with most physicians across Atlantic Canada that they know just to check off sometimes the CPAP trial. And we can talk about that if any of you have a question about that. But I'll show you what the CPAP looks like also. So the treatment, so this is the diagnostic tool, okay? And the treatment is based on the severity of the results that come back for your sleep study. So snoring or mild sleep apnea, OSA is obstructive sleep apnea. So the sleep noodle keeps you off your back. So some of you might say, well, when I'm on my back, I snore. Okay. Well, we can't tell that for sure unless you have your free sleep study first, okay? So that's the most important thing you can do for yourself if you do want to look into getting restorative sleep when you're having issues or any of those signs and symptoms or medical conditions that I mentioned. Then we can talk to you about treatment options. And Also, I've educated the physicians across the Atlantic Canada about treatment options, so they know, they have an idea of what we have to offer also. Sleep Noodle keeps you off your back. Like I said, if you do snore or you're stopping breathing on your back, this would keep you off your back. So it's good for mild or snoring after we see the sleep study. Okay. It's just like a little belt that goes around you. Some people used to use tennis balls or golf balls. That's not very comfortable. Plus, it's not very efficient. And I think they're only like $60. So they're not expensive at all. Okay. So our clinics would have these. A tongue stabilizer. The picture looks, funnier than it is. It works very well. But when we fall asleep, our tongue base falls back. Okay. So if you have a narrow air passage, and then your tongue is obstructing because it's larger base. It's like if you had extra weight, often like that tissue will be larger. So if you stabilize the tongue and bring it forward, that can improve your air passage size. Okay. So these aveos, I believe, are $140, and they're reusable. You clean them. It's a very inexpensive way to treat a snoring only. And remember, we have to know that from your sleep study first. And your sleep study will actually show if it's only snoring. Okay. And then, of course, there's always natural ways to help with mild sleep apnea and snoring, which is quitting smoking. Losing weight. Weight is a contributor, not always the cause. Develop your healthy sleep routine. So, some people are very mild and they snore, but as long as they're sleeping 9 hours, they feel rested, then it's not an issue, right? As long as they don't have sleep apnea. Because some people are very active and they sleep well, and then they have 2 glasses of wine every night and they smoke and they snore because they have an inflamed airway and they have a sedative on board. So that affects, their snoring. So stay hydrated. People tend to snore more in the winter when they're dry. Drink lots of water. Avoid alcohol. We talked about that, and sedatives. Get moderate exercise because that only improves your weight, your healthy body weight, but also improves your sleep quality to get into sleep and stay asleep. Sleep apnea machine. So they're not what you think, right? So we think that they're these big, loud, archaic machines that, no one could ever use that. And they're so small right now, and they're so quiet. And the masks are simple. They don't have to have this big giant mask anymore. So when patients come in, they're shocked at how small they actually are. So I'll show you those at the end also. Why is testing so important? Because why is testing for sleep apnea so important? Getting the quality of sleep improves many areas in our daily lives and ensure better health outcomes. We talked about lowering stress levels, better ability to cope at work and home stresses, right? So if we don't treat sleep disorder breathing and sleep apnea, okay, and we've done all the other things, then we won't be able to help our stress levels and work environment, okay? We won't get our focus and our productivity and our memory. So this is what it does for us. If we treat our primary sleep disorder, we can improve our interpersonal skills at work and home life. We can prevent and improve your blood pressure. So if you're on blood pressure medications, my patients often notice that their blood pressure starts to come down. And sometimes if it just started, they just started medication, they could come off of it with their doctor's help. Or their sugar levels, if they're pre-diabetic, often they don't need to go on medications. So, I like getting those patients before that happens. And irregular heart rhythms. So patients with atrial fibrillation, cardiology consults us every day to make sure that we're treating those patients with AFib, because then they don't necessarily need to go for ablation therapy, which is burning of the heart to reset it. So there's so many importance to why you need to treat your sleep apnea. And if, you know, maybe you were on CPAP and not using it, then you can also contact us. And then lower stroke and heart attack risk, right? Because when your air passage closes, your oxygen goes down. And when that oxygen goes down, that drives up our cortisol and our blood pressure. And then your heart works harder with low oxygen. So you're increased risk of a heart attack, right? And stroke, your blood pressure and poor circulation when you stop breathing can cause clots, okay? So it increases stroke risk. Sleep is the single most important thing we can do for our health. Single most important, I think. So I thank you for the presentation and your attention. And I guess Crystal's going to put me into question and answer time. So if anybody has any question, you can definitely ask away.
Let's see. All right, I'm just going to interrupt here very, very quickly. We'll give Maureen a chance to get a sip of water or two, because she did very well to go as long as she did. As I mentioned in the beginning of the webinar, I do have a poll, so I'm going to launch that now. And if you could do that, that would be wonderful. It's takes it's very, very quick, yes and no, and multiple choice. And that helps us to be able to determine if the direction that we're going with our webinar is going well. So I'm hoping that you will all jump into that. And by the time you finish that, then Maureen should be ready to jump into answering some questions. I know she has some equipment to show you as well for those of you who may be a little bit wondering what to expect as far as having to wear some of these devices. So she'll have a little bit of a show and tell as well as answer your questions. So please feel free to go into the poll. I've just launched it there now. Hopefully you can all see it. And I'll be quiet for a few moments and let you do that. Let's see. There we go. All right, Maureen, the show is yours.
Yeah, so if anybody has any questions, you're welcome to ask. I know it was a lot of information. I tried to squeeze as much as I could and get into those slides. Some of it's like interlapped and like links back slides. But, you know, if you have questions regarding how our clinics work, how like we're funded, how you're covered, I'm not sure what the insurance is, Crystal. Is it specific to each employee?
It varies depending on who has the plan. So it's I know with the Federation, you have to have a doctor's permission slip basically to start off with the process, and it is covered to a certain level. The initial part is covered, and then once you get further along, the equipment needs are assessed on an individual basis. So
okay, so if you do a sleep study, is that you don't have to be referred. We talked about that. You can self-refer, and you're going to put the link on the website, correct?
Yeah, and Maureen, I'm going to get you to stop sharing your screen. That way your picture will pop up a lot better.
Okay. How's that?
There we go. That's much better.
Yeah, so this is the sleep study. It's very easy for one night. You don't need a referral from your doctor, and Crystal's going to put the link. So if you're in PEI, there'll be a PEI link. If you're in Halifax or Nova Scotia, there'll be a link for that. If you're in New Brunswick, there'll be another link. And then you get to pick what location. In PEI, we have 2 offices, one in Summerside, one in Charlottetown, and you can book your sleep study on there. And it's a device, this device you take home for one night. Your doctor doesn't need to refer you, but your doctor will get the results. And we can review the results with you if you want to go over them also. Typically, the doctors take about, we take about a week to get the results back from the scoring polysomnographer who does all the scoring, just like the sleep lab would do. And then your doctor then will refer you on to treatment. And that treatment, what we were talking about with Crystal, is based on the coverage for a CPAP machine. The CPAPs that I was telling you that they've improved so much. Look how pretty this one is. So it's very small. I mean, it's the size of 2 of my hands. Okay, they're not big and archaic anymore. So if you have sleep apnea, your doctor would then prescribe it, and we would send away your insurance paperwork. And during a month-long trial, you would actually try the CPAP to see how you're feeling. If it's treating your apnea, which it will, we would do your insurance pre-authorization. So by the end of the 4 weeks, you determine if you want to continue and you're feeling better, based on also your finances with your insurance being pre-approved. You would then continue and get your new machine. Does that make sense? So it's a month trial. Okay, and this is what the mask looks like. Okay.
So for a month, do you keep like a log? Like, let's say you get the flu in the middle of it. Do you still keep wearing it through the flu or those sorts of issues?
Yeah, most people breathe better when their apnea is being treated, because we know, like in the wintertime, we get a cold. Your nose is plugged up, but as long as you're getting the pressure through your nose and you can get a good amount of air, you can wear it. If you have a stomach flu, you're not going to wear it because you have the risk of vomiting and aspirating. But yeah. And, it takes a good 2 weeks to not feel it on your face anymore. But I mean, when the masks are so small now, you really don't even notice it's there. A lot of people are shocked how small it is.
And for ages, what about, because I know primarily we're looking at adults and the farming community. What about if you have young people? Does it change size for younger people, or do you have an age limit?
Oh yeah. No, my 12-year-old's on a CPAP and my 9-year-old wants to use it. But 13 and over can do the sleep study. And if you have, 13 and over can do it. And if kids are under 13, they have to be referred by an ear, nose, and throat specialist. So they're called ENTs.
Okay.
Oh, I think there's questions.
Oh, there we go.
I don't have any trouble getting to sleep, but I wake early before my 7 and 9 hours is up. And my mind's racing. The earlier I go to bed, the earlier I wake. Should I get up when I wake up or come up with a solution to calm my mind and go back to sleep? So if you're having troubles getting back to sleep, you should definitely get up. But if you're waking up on a regular basis earlier than your 7 to 9 hours, I would want to know why. And the exclusion would be to do a sleep study to make sure that you're not having sleep disorder breathing. We don't often know that we have sleep disorder breathing. It's basically if you have any kind of awakening at night, right? Go to the bathroom often at night. You're not getting your full 7 to 9 hours. It would be very reasonable to say, do a sleep study and rule that out. But definitely don't lay in bed. Because if you are laying in bed, you're not supposed to lay in bed if you're there any longer than 20 minutes. So there's really good apps. Mind I think it's called Mind, that can help. It's very like monotone stories. And then there's sounds like white noise, which can turn your mind off so that you can fall back to sleep also. But make sure, like I said, your room, your environment is cold, not too cold, obviously, and quiet, and there's no light. And don't look at your phone in the middle of the night, because that definitely will suppress your melatonin, which helps you stay into deep sleep. That help? It said type answer, but you don't.
I pressed answer live for you so that you could speak, and hopefully our attendee was able to hear that. This is our very first webinar, folks. So for any technical issues or things that are going wrong, in me, it's all my fault.
Oh, it was the like. I think that. I think he or she saw that.
Okay, good. You're much better at this than I am. I didn't even see that one.
I'm kids Instagram and.
Oh Lordy. I'm going to ask you a question, Maureen, because I'm curious about this one. So you see a lot of advertisements for things like breathe right strips. What do you think of those? Do you think they're useful or a waste of money?
Right. Yeah, no, they are in a certain population, but we would have to know, we have to quantify what sleep disorder breathing you have. So it's kind of like if you had diabetes and you knew that you had high sugars, but we don't know what treatment to do right away, right? We have to monitor. So you have to have a diagnostic test to know what sleep device you need for your sleep disorder breathing. So if it was only snoring, it would show on the sleep study. Because 9 times out of 10, when patients do sleep studies, they don't often know that they have sleep apnea. They just say, oh yeah, well, I've never been a good sleeper, right? Well, you don't just become a not good sleeper. There's a reason behind it, right? So if it didn't show anything, like if it was completely normal, then we would then recommend things like good sleep habits, like we talked about. We would talk about blood work with your doctor. Most people have already had that when they're talking about poor quality of sleep. We would talk about weight management, sedation. But if you have a positive study and it's mild, we can talk about alternatives like breathe right. There's reusable nose cones you can get. That is like a reusable breathe right. They're cheaper. And those positional devices that keep you off your back.
All right.
Not everybody's CPAP, right?
Okay.
Yeah.
All right. Good. Does anybody else have any questions? So we're gonna try and wrap her up now because we're over the hour. We tried really hard to stay at the hour, but if you have any questions, and like I said before, if you want to send an email to me at farmsafety@peifa.ca, I'll make sure that Maureen gets them, and hopefully you fellas have found this useful. I'm not seeing any action here, so I'm going to take that as a sign that you've asked all the questions that you've wanted to. Maureen, do you see any hands up or anything, just in case I'm missing them again?
No.
All right. All right. Well, with that in mind, everyone, I just want to say thank you ever so much for coming to our very first webinar for the Building Sustainable Farmer. And I want to say thank you to Maureen for taking the time to do this and to discuss this very important issue. If you guys are interested, I really highly recommend you looking into the Snore Shop, and also using this information, passing it on with others, and talking to, maybe it's your very loud spouse, or somebody's coming into work and they seem to be very tired. Passing the information along, because that's what Building Sustainable Farmer is all about. Is we're trying to get the information out there for people so that they feel comfortable sharing it, and so everybody can be healthy and safe. With that in mind, once again, I'm just going to say thank you ever so much for coming, and I wish you all a wonderful and happy and safe and a restful evening.
Thank you.
All right then, everybody. Thank you. Bye-bye.
Thank you for joining. Bye-bye.